I'm joined by Louise Fish, the Chief Executive of Genetic Alliance UK, and Marian who has Stevens-Johnson syndrome. Thank you so much for both being here. Louise, let's start with you. 3.5 million people in the UK are affected in some way by a rare condition in their lifetime. And with 7,000 different conditions and new conditions regularly identified as research advances, there are real challenges, aren't there, in coordinating healthcare, diagnosis and treatment?
There are. We think around 8 out of 10 of those conditions are genetic in their origins, and some conditions are so rare that they just affect 1 or 2 families in the UK. Some conditions are so rare that there may only be 1 person in the UK yet, and we may not have a name for that condition yet, so it remains undiagnosed. So coordinating care for that 3.5 million, unless we better understand who they are and what they need, is definitely a challenge.
Marian, you have Stevens-Johnson syndrome. Can you tell us about your experience? Because actually your symptoms came on very fast indeed.
It did. First and foremost, thanks for having me. Literally I suffered from Stevens-Johnson syndrome back in 2011. And it was literally just from eye drops. My eyes were itching me, and next thing you knew, my skin was blistering. My airways was closing up, and from there, one thing led to another. So I never knew it would lead to the extent of my skin peeling off and me being put into an induced coma for a month and overcoming what I overcame, which is the Stevens-Johnson syndrome. So very horrific, I must say.
Now, in some ways, you were lucky because actually a doctor that you saw did actually recognise those symptoms.
Yeah. So it was actually during the swine flu season. Like literally, I was throwing up thick blood was gushing out of my eyes. And he was like, this is not swine flu. This is something known as Stevens-Johnson syndrome. So initially I was at Mayday Hospital, and they moved me to a specialist hospital known as the Royal London Hospital in Whitechapel. So that's where they were able to find out about what I had and obviously do the necessary support checks and stuff like that with regards to my medical condition.
You'd never obviously heard of Stevens-Johnson syndrome before, hadn't you? How scary was it actually going through that?
It was horrific. How I explain it in my book is that you're like boiling from inside out, and the pain that you're feeling, like even to go to the bathroom was excruciating pain. To do anything was obviously excruciating because my skin is literally shredding off. Like literally from the crown of my head to the sole of my feet, my fingernails, toenails, everything shredded off just from eye drops.
Louise, how rare is Stevens-Johnson syndrome, and is Marian's story typical?
Yeah, so one of the challenges we have in the UK is that we don't have very good data about who has rare conditions. And so researchers estimate that between 2 and 7 people per million have Stevens-Johnson syndrome, which in the UK would be less than 500 people. One of the things we'd really like to see is much better segmenting and understanding of the data about the 3.5 million people who have rare conditions, so we can better understand who they are, which conditions they have, and just make sure that the NHS is providing the right services and support to help people throughout their lifetimes.
I mean, that said, we are in a general election year, 2024. What commitments are you looking for from the politicians?
Well, we have something called the UK Rare Disease Framework in this UK, and it was put together with input from people living with rare conditions and their families, from health professionals and from the pharmaceutical industry. And it set out a range of ambitions around getting faster diagnosis, better coordination of care, better access to both treatment and support, and more awareness of rare conditions among health professionals. And so those we think are the right ambitions. And in a general election year, we'd really like to see politicians from all parties recommit to those ambitions and to be investing the time and people needed to actually make that set of ambitions into a reality.
Marian, for you, I mean, you've turned your quite horrific, as you said, experience into a positive, haven't you? Because it is rare, you've been going out there and raising awareness. How have you been doing that?
I have, yeah. Well, with support from Genetic Alliance and their awesome work that they're doing, sharing their content on social media. I also started a campaign called My Scars Tell a Story photography campaign. So yes, it's based off the back of my story of Stevens-Johnson syndrome. So I'm still able to spread that awareness, as well as sharing the stories of many others that suffered from different types of skin conditions and getting the representation out there with regards to medical support, ongoing support, follow-up support, because these are the things that I didn't receive when I had Stevens-Johnson syndrome. So I feel like it's my responsibility to go and support those doing research in these areas and find out a better way how you can support patients like myself and also give them a voice to be heard within this area.
And how are you feeling now?
Super excited. Looking forward to what else is to come. But yeah, it's been a journey. It's been challenging. But at the same time, I'm alive to tell the story and just want to continue making an impact in the lives of people.
Louise, Marian, thank you so much for your time. Really
Thank you so
interesting.
much for having me.
Thank you.